everyone. This is Ken with Ken's Insurance Agency. This morning we're going to be talking about Medicare and the different aspects of Medicare. We'll go through our marketing slideshow and show you different things. This will be posted on social media, so be looking for that upload soon. And let's get started. So Medicare, what is it and what is it for? Medicare is your health insurance when you turn 65 and older. It's also for disabled people that have been on Medicaid for 24 months or more that don't have other insurance provided through like a parent's work or a spouse's work. In some cases, low-income families can qualify for Medicare also. So that's who Medicare is for. It comes in several different parts. You got Medicare Part A, which is your hospitalization. You got your Medicare Part B, which is your doctors and specialists. You got Medicare Part C, also known as Medicare Advantage. Usually Part C is sold with Part D. You got Part D, which is your prescription drug coverage, and then you got your supplements. And we'll go through each of these in more detail. So, open enrollment every year is from October 15th to December 7th. You've also got an enrollment period starting the third month before your birthday. So let's say your birthday is in March, then it starts in December, December 1st to February 28th is the first 3 months. Then you have the month of your birthday. And then you have 3 months after your birthday to sign up when you turn 65. So that is the most common one. Also, just like with the underage health, you have special enrollment periods. These can be anything from like receiving Medicaid to low-income subsidy people to people that's moved outside of one plan's coverage area to another plan's coverage area. They get a step to be able to sign up for coverage in their new area. Basically, a plan stops covering in a certain area and drops the client. They get a SEP to be able to sign up for a new plan. So these are your SEPs. You can face penalties if you do not sign up for Medicare Part A, B, and D around your 65th birthday, or if your coverage lapses and you don't use the SEP to sign up for a new coverage. Every year you must sign up for new coverage and be reviewed accordingly with Medicare. So Medicare Part A covers inpatient hospital care, skilled nursing facilities, long-term care hospitals. Most people don't pay a premium for Part A. If you buy Part A, you'll pay up to $422 each month. If you pay less than 30 quarters, the standard Part A premium is $422. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $232. You'll have a deductible of $13.40 each benefit period. A benefit period is 90 days. So every 90 days it resets. Days 1 through 60, you have a $0 co-insurance for each benefit period. Day 61 through 90, you have a $335 co-insurance per day of each benefit period. And days 91 and beyond, a $670 co-insurance for each lifetime reserve day after 90 days. So once you use up your lifetime reserves, basically it's over with, and you have up to 60 days over your lifetime for your lifetime reserves. Anything beyond the lifetime reserve days is all cost. So that's why it's best to have something to help offset that and give you maybe some more days. Part B covers two types of services. Medically necessary services, which can be services or supplies that are needed to diagnose or treat your medical condition and that it meet accepted standards of medical practice. Preventative services. So healthcare to prevent illnesses like the flu are detected at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get the services from a healthcare provider who accepts assignment. Part B also covers clinical research, ambulance services, and durable medical equipment. Mental health costs, inpatient, outpatient, partial hospitalization, getting a second opinion before surgery, limited outpatient prescription drugs. Two ways to find out if Medicare covers what you need. One is to talk to your doctor or healthcare provider, and the other is you can check with Medicare itself. Medicare coverage is based on three factors: federal and state laws, national coverage decisions made by Medicare about whether something is covered, and local coverage decisions made by companies in each state that process claims for Medicare. The standard Part B premium amount is $134 or higher depending on income. However, some people who get Social Security benefits will pay less than this amount, $130 on average. $183 per year deductible is with Part B, and you typically pay 20% of Medicare approved amount for most doctor services after your deductible is met. Medicare Part C, otherwise known as Medicare Advantage, is a plan that will cover your medical and doctors, and it also covers your hospitalization. It's provided by a private insurance company, must have Part A and B, usually includes Part D. It's very affordable price. You're usually talking $0 to around $100 in premium, depending on the plan you go with. Has deductibles, copays, and co-insurances. So that's the downside to it. But again, it's very affordable. Usually comes with extras like the ability to get a gym membership, hearing, vision, dental, So that's that. Medicare supplements a way to pay for your out-of-pocket expenses on Medicare Part A and B. You must have Part A and Part B. Cannot have Medicare Part C. Part D sold separately. It's more expensive monthly than Part C. You're looking at starting out on average $112 and it going up from there. Broken into different versions: A, B, C, F, high deductible, G, M, and N. And to let you know, C, F, and F high deductible, they are looking at going away as of 2020 other than on group plans. So you will not be offered these at this open enrollment period. Can have a deductible and co-pays and co-insurances. Usually does not have extra services like hearing, vision, dental, and does not come with a free gym membership. Part D is your PDP or prescription drug coverage. Prescription drug coverage provided by private insurance companies must have Part A and B. Can be part of a Medicare Advantage Part C or sold with a supplement. If you have a Medicare Advantage plan, you must buy it with the Part D that is included in the plan. Each Medicare drug has its own covered drug plan, has its own covered drugs called a formulary. They're broken up into tiers. Drugs in each tier have a different cost. A drug in a lower tier will generally cost you less than a drug in a higher tier. A Medicare drug plan can make some changes to its formulary during the year within guidelines set by Medicare. They must provide you written notice within at least 60 days prior to the date the change becomes effective. At any time you request a refill, provide both of these: a written notice of the change, a 60-day supply of the drug under the same rules as before the change. You'll make these payments throughout the year in a Medicare drug plan. Premium, yearly deductible, co-payments, and co-insurances. Cost in the coverage gap. Cost if you get extra help. Cost if you pay a late enrollment penalty. Your actual drug plan costs will vary depending on the drugs you use, the plan you choose, where you go to a pharmacy in your plan's network, whether the drugs you use are on your plan's formulary, whether you get extra help paying for your Medicare Part D costs. So those are some things to think about. And then we go into some more stuff on the Medicare Advantage. Don't really want to spend a ton of time on this. We would spend more time on it if you was talking and stuff. But some things that we want to look at is if you're in the coverage gap, you have spent $3,820 to enter the coverage gap. You'll pay a little bit more for your drug costs at this point. Once you reach 5,100, you come out of the coverage gap and you go into catastrophic coverage where you pay a lot less for your drug cost. Some other supplements that we can sell with a Medicare Advantage plan is cancer, critical illness, hospital indemnity, and Medicare Gap. These are great for offsetting any out-of-pocket costs and for uh, putting money back into your pocket for covered ailments. And this is all that we have for you. Also, remember to contact us for all your insurance needs, whether it be health insurance, Medicare, life insurance, retirement planning, financial planning, prepaid legal, auto, motorcycle, ATV, RV, home insurance, renter's insurance, condo insurance, landlord tenant insurance, commercial insurance, benefits packages, and even our added value services like identity theft protection, credit repair, and so forth. You can also get all the information on all of our services by going to our website, kensinsuranceagency.net. That's KENSINSURANCEAGENCY.net. You can also call us at 662-292-6271. Again, that number is 662-292-6271. We look forward to being able to help you and hope you've enjoyed this webinar. Feel free to give us a call again at a later time. Thank you and have a nice day.